When you truly, truly care about someone, you convey what's important to you in a way that's important to that other person, in the value system of that other person. And Socrates talked about this 2,000 years ago when he said, the seer, the seeing, and the seen are the same. The seer, the seeing, and the seen are the same. And what he said was that what you see in other people is there in you, but you're either too proud or too humble to admit it. And if you're too proud and humble, you're going to have deflective consciousness. But if you just see people as reflections of who you are and not put them on pedestals or throw them in pits, you have reflective consciousness rather than deflective consciousness. Because people are just people, and what you don't like in somebody else is really because you don't like it in yourself. That's the kind of the behavior around things. So true caring. An example of that in my practice was that those white private forms, with the occupation on the top right hand side, I used to really make sure that I worked out what the patient's occupation was. And if they didn't write anything down there, I used to say, so what do you do for a living, Mr. Jones? Are you working at the moment? Something to engage with that patient so I can find out what their value is. Now, sometimes people work in jobs because they have a high value in it, and that becomes their occupation. And most times I got this right. So for example, if I was dealing with somebody in investments or stocks and shares, I'd communicate to that patient, not out of manipulation or coercion, but because I want to get my communication across. Mr. Jones, if you had this treatment, the return on investment would be so and so years. If I dealt with somebody in the property industry, I talk about the house, the root canal being the foundations of that tooth, the walls of the tooth being the filling inside the tooth, and the roof of the tooth being the crown. So I draw it out for them, but I say it in a language that the person could understand it, and I had probably about 90-95% uptake of treatment. If I had a patient who didn't want my treatment, I'd be like, what did I say to that patient that they don't want to have my treatment? Because somebody rejects your treatment and don't want the treatment, you're not creating in business enough value for that person to take up that treatment. There's something in your communication which the message isn't getting across. And that's kind of like a sales thing, but I'm just introducing that very, very carefully here. There's something that you're not doing in your own values, and you're not creating enough value for that person to say, yes, I'll take up your treatment, doctor. So that's true caring.